Hello, I'm Danny, a health writer currently completing my master's in nursing and someone who spends lots of time looking at the gap between what science tells us and what people understand about their health. Today, I want to talk about IBS and anxiety, specifically why they show up together so often, what's driving that, and why it matters for how to go about getting help. Because the standard explanation that stress makes IBS worse or that IBS is somehow psychological isn't wrong exactly, but it's incomplete in ways that lead a lot of people down the wrong path. The science here is more interesting than that, and honestly more useful, so let's get into it. IBS affects somewhere between 5 and 10% of adults worldwide. Symptoms, abdominal pain, bloating, diarrhea, constipation, or some combination, tend to be chronic and unpredictable rather than one-off, which is part of what makes it so exhausting to live with. One thing that often gets lost is how IBS is now actually classified. The Rome Foundation, which is the international body that sets diagnostic criteria for GI conditions, categorizes it as a disorder of gut-brain interaction, or DGBI. This means IBS isn't purely a gut problem, and it's not purely psychological either. It sits at the intersection of both, which has real implications for how it should be treated. Research has identified measurable biological changes in people with IBS, altered gut motility, shifts in microbiome, low-grade immune activation, and increased nerve sensitivity in the digestive tract. These are physical findings, not abstractions, so it's just stress as an explanation isn't really helpful. It's scientifically incomplete. Now, I want to talk about anxiety, and I mean something more specific than general stress or worry. Whether it's generalized anxiety disorder or low-level chronic tension, what a lot of people carry around, without naming it, anxiety involves sustained activation of the autonomic nervous system. That's the system that runs things you don't consciously control: your heart rate, breathing, and yes, also your digestion. When that system shifts into a heightened state, cortisol rises, blood flow gets redirected, and digestion gets deprioritized. In the short term, that's just a normal stress response, and the body is doing what it's designed to do. The problem is when that state becomes the baseline, when your nervous system is regularly telling your digestive system that it's not the priority right now, things start to break down. Gut motility changes. The threshold for what registers as pain drops, and something else happens that most people aren't aware of. The composition of your gut microbiome starts to shift. Your gut is home to trillions of bacteria, and certain strains play a direct role in producing neurotransmitters, including serotonin, the majority of which is actually made in your gut, not your brain. Strains like bifidobacterium, for example, help regulate neurotransmitter metabolism and support the body's ability to manage stress responses. When chronic stress disrupts the balance of these bacteria, a state called dysbiosis, that production process goes wrong. Part of what drives this is a metabolic pathway called kynurenine, a pathway that under normal conditions the amino acid tryptophan is used to produce serotonin. But under chronic stress or inflammation, tryptophan gets diverted down the kynurenine pathway instead, which means less serotonin is produced, and the compounds that are produced can actually promote further inflammation and anxiety. It's a self-reinforcing cycle that operates at a biochemical level well below what we'd normally think of as psychological. These are measurable physiological processes, which is why anxiety doesn't just make you feel like your stomach is in knots. It can fundamentally alter the biological environment of your gut over time. So why do these two conditions appear together so consistently? And I want to be precise here because the research has moved beyond just saying they are linked. A study published this year in 2026 by Yang et al. In Food Science and Nutrition investigated the relationship between IBS and generalized anxiety disorder. The study used a genetic analysis method specifically designed to establish causality, not just correlation. The findings were clear. IBS is a genuine causal risk factor for developing general anxiety disorder. It's not just that they occur together. IBS meaningfully increases the biological risk of anxiety. The study also mapped out causal relationships between gut microbial taxa, immune cells, inflammatory markers, and both conditions, revealing just how many biological pathways connect them. What's particularly important about that finding is the direction of causality. The reverse analysis testing whether anxiety causes IBS did not show the same link. So while anxiety clearly affects gut function through the mechanism we've already covered, IBS-driven anxiety appears to be the stronger causal direction, which tells us something important about where intervention is needed. The experience of living with IBS creates its own psychological weight, and it's not just emotional. Many people develop what researchers call anticipatory anxiety, a constant background calculation of when the next flare might hit, whether they'll be somewhere manageable, and whether they can eat before a long journey. Over time, this trains the brain to be hypervigilant, monitoring every abdominal sensation far more closely than it normally would, which in turn amplifies what you feel. And then there's visceral hypersensitivity, where the nerves in the gut become more reactive than they should, and so normal sensations like gas or mild stretching that most people wouldn't notice can feel genuinely painful, combined with a dysbiotic gut microbiome that's producing less serotonin and more inflammatory compounds. You have a biological environment that's exactly generating anxiety, not just responding to it. Each element feeds the other. That's the loop that's hard to break when you're only treating one piece of it. This explains something a lot of people with IBS have experienced but struggle to articulate. If you manage the gut symptoms in isolation through diet changes, medication, supplements, you might get some relief. But if the gut-brain feedback loop is still running, symptoms tend to creep back. You've addressed the output without touching the driver. And if you manage the anxiety in isolation, therapy, medication, stress reduction, that can genuinely help. But if your gut is still physically hypersensitive, your microbiome is still dysbiotic, and you're still having regular symptoms, the anxiety has a real ongoing biological trigger. Progress is slower and harder to sustain. The research on this is pretty consistent. The best outcomes come from addressing both sides at the same time within a coordinated plan, not sequentially, not separately, but together. That's exactly what standard care often doesn't offer. A GP might refer you to a gastroenterologist or to a therapist, rarely in any coordinated way, and rarely with a dietitian involved as well. The system is set up to treat these as separate problems, which means a lot of people end up feeling like they've tried everything when really they've tried several individual pieces of the puzzle, but never at the same time. The good news is that there are effective evidence-based options out there. On the gut-brain side, gut-directed hypnotherapy has some of the strongest clinical trial data behind it for IBS. It works by targeting the gut-brain axis directly, helping to dial down this hypersensitivity and hypervigilance that keeps symptoms going. CBT adapted specifically for IBS has also shown real results, both for symptom severity and for the anxiety that tends to travel with it. On the dietary side, working with a registered dietitian who actually specializes in GI conditions is different from following the generic low FODMAP protocol you found online. The goal isn't just identifying trigger foods, it's building a way of eating that supports a healthier microbiome balance and doesn't keep the nervous system in a heightened state around food. And medication, where appropriate and prescribed by someone with GI expertise, can help manage specific symptoms, pain, motility, diarrhea, or constipation, while other work is happening. What the evidence keeps coming back to is that combining these approaches works better than any one of them on its own, which raises the obvious question: how do you actually find care that brings all of this together? If you're at the point of actively looking for support, it helps to know what you're looking for, because the options vary a lot and not all of them are designed for what IBS actually involves. The The first thing I'd look at is whether the provider genuinely specialises in GI conditions. General telehealth is useful for a lot of things, but it's not built for long-term specialist GI care. You want someone with the clinical background to understand your symptom patterns, make informed decisions about testing, and actually diagnose rather than just manage. Next is dietary support built into the model, or is it something that you'd be referred out to separately? A dietitian who's communicating with your GI provider and working from the same picture is going to be a lot more useful than someone operating on a standalone referral. Then, is gut-brain support part of the clinical plan? Not suggestions, but not a pamphlet, but actually part of how your care is structured. Given everything we've talked about today, it should be standard, not optional. What does it cost, and is it in network with your insurance? Specialist GI care has a reputation for being expensive and hard to access, but that's changed more than most people realise, particularly with virtual options. It's worth checking before you assume it's out of reach. And how long is the wait? Well, months for a GI appointment is common in traditional settings. That's a long time to be without a plan when symptoms are active. One option that fits the criteria is Oshi Health, virtual GI clinic built specifically for people with ongoing digestive conditions. Patients work with a dedicated team, a GI provider with specialist training, a registered dietitian focused on gut health, and a behavioural health provider who works specifically on the gut-brain side of things. It's all overseen by board-certified gastroenterologists, and the team operates from a shared care plan rather than separately. You start with a personalised plan built around your specific symptoms and history, and you work through it with your team. That structure matters if you've been managing things piecemeal for a while, and if symptoms flare up later on, support is still there. On Access, most patients are seen within 10 days, and Oshi is in network with major plans. Their reported outcomes show 92% of patients experiencing symptom relief within 10 weeks. For people dealing with both the gut symptoms and anxiety feedback loop, we've been talking about having all of that in one place rather than coordinated between providers who aren't talking to each other is often what moves things forward. You can find out more at oshihealth.com. Before we finish, one thing worth saying clearly, IBS is common and very manageable, but there are certain symptoms that should always be assessed by a doctor in person, not waited out or managed at home. Blood in the stool, unexplained weight loss, persistent vomiting, severe abdominal pain, or new symptoms starting after the age of 50. These don't automatically mean something serious, but they need to be properly looked at. If any of those apply to you, please get seen. IBS and anxiety aren't just conditions that happen to coexist. They're connected through measurable biological pathways such as the gut-brain axis, the microbiome, and immune signalling. The research is clear that treating them separately or treating only one side tends to produce results that don't hold. What works better is addressing the medical, dietary, and gut-brain dimensions together, not sequentially and not in isolation. If you've been at this for a while and feel like you've tried a lot without getting where you want to be, it might be worth asking if the care you've had access to is set up to treat the whole picture. Thanks for watching Health Hackers. Subscribe for more evidence-based conversations about health and take care of your gut.